Good evening. This is Anissa Marie, and you're tuned in to second episode of Out of the Blue. I do apologize for not coming before now. It's been a couple of weeks. As you can hear, I don't know, I guess I have sinuses. So I've been trying to take care of that. But anyway, I just wanted to jump right into this video. I've had a couple people contact me and actually ask me to talk about this video. So in today's video, we will talk about, and excuse me, I'm sorry, this is really not professional, but I'm gonna have to dab my nose because I'm telling you, I've taken medicine all day. Nothing's working. Anyway, today's video, mental health in the Black community. That's what we're gonna talk about. I'm gonna touch on that really briefly. And we're going to talk about the psychological impact that it has on the Black community. So basically, from my experience, being a Black professional female in this pandemic, I've run across people that have had job loss. Fortunately, thank you, God. I'm a nurse, so I'm essential personnel, so I can work. But there's a lot of people that don't have income. They can't work. They're not working. They're looking for streams of income. They're looking for ways to make money to take care of their families. So, jobless, images of Black men, specifically George Floyd, begging for his life, begging for his mama. Images of Black men being murdered, Black people being murdered on TV, on the internet, and also this COVID-19 social distancing. Our men and women not being able to go to, certain areas like community spas, barbershops, gyms, beauty parlors, churches, where you can go and you can talk to people. You can sit, you can get your hair cut, and you can get your eyebrows waxed. You can get certain services, and you can talk to people. Because a lot of times people don't have anybody to talk to. They don't have anybody to talk to until they go to the barbershop. So because of these things, it has caused a psychological impact on the Black community specifically. And it's very exhausting. Okay, it's a very exhausting situation because what it does, it forces you to go within, to really dig deep, and that's what God wants us to do anyway. I believe He really wants us to get closer to Him in this pandemic. Also, deaths from COVID. People dying at an alarming rate, specifically Black people being diagnosed or misdiagnosed with this COVID pandemic. I don't know who that is that's coming down the stairs, but I wish they would just come on, honey, because they just really, really... Anyway, death from COVID, Black unemployment is at a all-time high, 14.6% decline of people having jobs in the month of July alone. So people dying from COVID, people not having job security, seeing images of Black men being killed, Black women being killed, and also social distancing is causing a lot of mental health issues in the Black community specifically. And the reason why I'm touching on Black people in general is because we are the number one group that never go seek counseling. We never talk to anybody about it. We won't go and get help. We don't even believe that we have issues. We even have problems. And also one other thing that I've been dealing with myself is just renewed but long simmering anger and anxiety over public police brutality, and also just realizing that slavery happened realizing it and discovering it and looking at it for what it was. Images of people being lynched and people being killed. Those images, they've been there. We don't just do away with them or just forget about them just because we don't talk about them. They're still there, and they're very much in our psyche. So when we don't have anybody to talk to about that, we don't have anybody to commune with that. The churches are closed. Barbershops are limited. Gyms are closed. I can't even go to the gym, to work out, talk to anybody. It causes you to really, really dig deep within your mental psyche and get to the root of what's going on. And a lot of times, you can start to develop habits that are not good, like substance abuse, alcohol, engaging in, a lot of premarital sex, just different things that are tearing down the structure of the Black family. I'm going to read you something. I'm so sorry. My nose is running. According to the Substance Abuse Mental Health Services Administration, or SAMHSA, 16% reported a mental health illness of nearly 5 million African Americans with mental illness. 70% received zero treatment. That means we ranked the highest, but we didn't get any treatment. And the reason why we didn't get any treatment is because there's a shortage of Black professionals in the mental health industry. Luckily for me, my daughter, Natasha Smith, is, studying right now, going to school, receiving her master's degree in mental health counseling. So I'm very, very happy about that. And, it's my due diligence to just, shed light on that. I've had about 5 people to come to me and tell me, Anissa, you really need to talk about mental health in the Black community because we don't really have a lot of people to talk to about these things. So dealing with mental health as a whole for Black men, and even as Black women, is seen as a taboo. It's seen as a sign of weakness, especially for those of us that are free descendants of former enslaved people who survived racism and brutality and abuse. It's seen as you need to, get over it. You need to, deal with it, but don't deal with it in a public forum. So it's kind of like you take that stuff and you take it home with you and you box it in. Instead of seeking help, many people resort to self-medication through alcohol and drugs or isolating themselves, away from people, not wanting to deal with people, not wanting to talk to people, not wanting to reach out and, let people know how they're doing. And the suicide rate is at an all-time high because of those issues. So I think the resolution for this is we need more Black psychiatrists, for one. Ooh, okay. The Lord is doing his work, and he agrees. We need more Black psychiatrists. You heard that rumble, right? Thank you, Lord. Community leaders and mental health workers should team up and advocate for more services. And we also have to remember to not only look after body and soul, but the mind as well. We have to look at what we do, what we engage in and what we bring into our mental psyche, the things that we entertain. It could be low vibrational people, on low energy. It could be, just being in an abusive relationship or being around abusive people, getting caught up, with that in itself. So that kind of concludes what I want to talk about as far as the mental health challenges that we face as a community. I would say, seek counseling, seek help, get the 1-800 number, get the hotline number, find out how you can be active in somebody else's life. If somebody is dealing with something, those who know me know that I know I'm a servant, I'm a servant of people. So if anybody, should need anything from me, if anybody calls me, at a drop's moment's notice, I feel like it's my due diligence to be there for that person. So I would say in your personal lives, be there for people. You don't really have to take on everything that they're dealing with. You don't really have to, take all of it in and keep it, but at least be a beacon for them, because you never know what somebody's dealing with. Sometimes people just need an ear. They need to be able to talk to somebody. They need to be able to just unleash what they're dealing with. And it doesn't always have to be a trip to the doctor, to the psychiatrist. You can work through these things through journaling. For me, I'm going to say for me, because everything doesn't work for everyone, but I'm just going to tell you my personal experience. Journaling, writing out, how I feel. Painting. I just discovered a new love of painting, and I don't know how to paint, but I appreciate art. I appreciate looking at beautiful art, beautiful things, discovering, new talents. Just looking to see if I have, if I haven't gotten into the instruments yet, but I'm sure if I apply myself, there would be something there that would resonate with me. So just finding different outlets to deal with your frustration and your mental illness and your mental health, your psyche, because when you go to bed at night, all you're doing is you're just running these things through your head, or I'll say I'm running these things through my head, different things all through the day. And you got to learn how to turn that stuff off. You got to learn how to connect, with the source, with your source, your energy, whoever that may be for you. You have to unplug, you have to turn the TV off, you have to get off the internet, you have to quit looking at everybody else's life and what they're doing. And, they're going to be doing it tomorrow. So you have to dedicate time for yourself. If it's 20 minutes, 30 minutes, an hour, you have to get somewhere where you can just get quiet with yourself and meditate and be at peace, so you can deprogram and unplug from the matrix. That's really what it is. So this is a brief video. I said I was going to try to get a video out today. I've been busy just with life, but I'm going to start utilizing more, of my time. We all get 24 hours. So I'm trying to, utilize each hour and prioritize and delegate and get organized, like my daughter said. So with that being said, you guys have a blessed evening. I didn't even drink my water, Lord. Get your 8 glasses of water in. I'm going to give you a little tip. A natural way to cleanse, because I'm on this cleanse thing now, is to take 2 tablespoons of Epsom salt, which is like a laxative Epsom salt, and add it to some water, warm water, and drink it. And within 4 hours, you'll have a nice cleanse. Okay, and then that way you don't have to worry about spending all this extravagant money on stuff, on stuff that's probably not going to work for you anyway. That's a natural, quick way to detox and cleanse, and that's what I'm trying to do right now. I'm trying to get, to a point where I can cleanse my body, so I can hear, I can hear from the spirit more. I can hear clearer, and you gotta get rid of all the junk. I'm working on that. I'm working on the sugar. I'm working on the salt. I'm working on all this stuff. The meat. I'm trying to get back to, one meat because we were doing good. We were just not even eating meat, just seafood. And then holidays came and it was over. So with that being said, I bid you adieu. You guys have a wonderful evening. And this has been Anissa Marie with Out of the Blue.